What if one medication could help control blood sugar, promote weight loss, protect your heart, and even improve kidney health? Today, Respivida is diving deeper into GLP-1 receptor agonists and GIP medications. You may know them as Ozempic, Mounjaro, Wegovy, and Zepbound. We'll cover how they work, the benefits they offer, what risks they present, who they could potentially help, and how you can stay safe. So let's start with the basics. What is GLP-1? GLP-1 is an acronym which stands for glucagon-like peptide 1. The emphasis is on the word like. GLP-1 mimics a hormone called glucagon. Real glucagon hormone is released into your body from the small intestines after eating food. GLP-1 receptor agonists medications such as Ozempic and Wegovy act like the glucagon hormone by tricking the body into thinking glucagon has been secreted without you needing to eat any food. GLP-1 stimulates and enhances the natural production of insulin, meaning more insulin for better blood sugar regulation. This effect also suppresses more glucagon hormone from being made, while promoting the feeling of fullness and decreasing your appetite. With enhanced insulin regulation and less glucagon hormone, GLP-1 slows gastric emptying to reduce blood sugar spikes, while sending signals to the brain to reduce your desire to eat. The overall results shown from the use of GLP-1s are better blood sugar control, less hunger, and often weight loss. This leads to better sleep, breathing, and reduced cardiovascular risks. New research is showing promising results for improving liver health, renal function, and a link to neuroprotection with Alzheimer's and Parkinson's patients. In terms of administration routes, most of these medications are either daily or weekly injections into your body, with the oral route just entering the market. Dose amounts start small, but increase over time to a max amount. The amount depends upon the product type and your doctor's prescription, which is required for all these medications. A second medication that has been combined with GLP-1 is called glucose-dependent insulinotropic polypeptide, or GIP. GIP is the hormone that is made and released by K cells in the upper small intestine after you eat food. The production of GIP is triggered by fats and carbohydrates, and it helps stimulate insulin and influence fat metabolism, especially within body fat. What's the difference between GLP-1 and GIP? GLP-1 has a strong appetite effect and suppresses glucagon. GIP's appetite effect is milder, but can influence fat handling. In essence, GIP boosts your metabolism to shift towards fat burning rather than storage, while GLP-1 tells your brain you don't want to eat. Understanding both hormones helps explain why combining them may be powerful in some situations for patients. Tirzepatide, sold as Mounjaro and Zepbound, activates both GLP-1 and GIP hormone receptors. With both combined, GLP-1 controls blood sugar and appetite, while GIP boosts fat burning and metabolic flexibility. Clinical trials show greater weight loss and improved glucose control when both GLP-1 and GIP are combined. But higher efficacy can mean stronger side effects for some. We'll cover the risks shortly. Beyond glucose and weight loss, studies show cardiovascular protection. This means these medications have the potential to lower your risk of heart attack and stroke. They also have shown renal benefits by slowing down the progression of chronic kidney disease in some trials. For weight loss, the average loss in weight often ranges from about 8 to 15% of body weight, depending on the drug and dose. If that wasn't enough, there's new, emerging evidence for fatty liver improvement and ongoing research into neuroprotective effects for Alzheimer's and Parkinson's. Weight loss and improved insulin regulation have been shown to enhance both breathing and sleep quality. These changes can significantly reduce the risk of obstructive sleep apnea, stabilize blood pressure, and increase respiratory stamina. As oxygen levels improve, patients often experience fewer asthma and COPD flare-ups, especially those triggered by excess weight or sleep-related disruptions. In short, GLP-1 and G provide blood sugar control, weight loss, heart and kidney protection, and now are showing promising signs for liver and brain health improvement. As with any medication you take, there are always potential side effects and risks you must consider and discuss with your doctor before starting. Let's take a look at some of them now. The most common side effects seen with GLP-1 and GIP medications include nausea, vomiting, diarrhea, constipation, and injection site reactions. Even though very rare, there can be serious issues including pancreatitis, gallbladder problems, and severe dehydration. It is highly recommended you absolutely do not take these medications if you have a personal or family history of medullary thyroid carcinoma or MEN2 syndrome, and if you are trying to become or currently are pregnant. The best practice if you meet the requirements to use these medications is to start low and go slow, stay hydrated, eat small balanced meals, and report severe symptoms immediately to your doctor. Your safety is vital to this being a successful treatment for you. Beware, there are several compounding companies providing off-label and unregulated GLP-1 and GIP as potential substitutes to the branded medications. This may seem attractive if you can't afford the medication or do not have a prescription. However, the medication is not being regulated or tested for efficacy, so it may simply be, well, anything. The companies do not have to report or maintain quality standards like an FDA-regulated pharmaceutical company listing the medication as all-natural. Use sound judgment and discuss this with a doctor first before buying anything. Yes, the cost for the medications may be very expensive, especially if paying out of pocket. Access to it may require additional insurance authorizations or medical approvals before payment, but you may qualify for assistance programs to help you. Age and chronic conditions also play a factor. Older adults and those with kidney or liver disease can use them, but with monitoring, GLP-1 and GIP medications are powerful tools, not magical cures. For them to work best, you will need to change your daily habits, ensure you drink plenty of water, stay active with physical activity, monitor your side effects, and consult with your doctor if any issues or concerns arise. Respivida is here to help you with your breathing, sleep, and daily life. Be sure to like this video, subscribe to our YouTube channel for more information like this, and share this video with a family member or friend. We want to help you. Breathe easier, sleep well, and live better with Respivida.